Hi, I'm Tamari Mitchell, and this is my week 5 lab video.
I'm Quincy next, and I give her permission to record me. Come in.
I'm performing hand hygiene, putting on my gloves. Hello, Mr. Banks. How are you today?
Good.
Good.
How are you?
I'm good. Thank you for asking. I'm Tamari Mitchell. I'm a student nurse at Chamberlain University, and today I'm performing a respiratory assessment on you. Will that be okay?
Yes.
It'll take 6 to 7 minutes tops. That's about it. Okay? Get you in and get you out. Alright, so I'll start off with asking you some questions. Have you ever smoked before, or do you smoke currently?
No.
No? Any previous history of lung issues such as asthma, bronchitis, emphysema?
No.
Okay, good. Alright, so with doing this assessment, first thing I'll do is observe his chest. And so I'll note that his respirations are within normal limits, as well as the rhythm of his breathing is consistent and regular, smooth, and as well as when he takes his deep breaths and his respiration, it's deep, it's not showing any signs of retraction or bulging of the chest or any of that sort. I'll also note that he is sitting upright, he's not hunched over, showing any signs of desperation for air or anything of that sort. And as well as I'll look at his chest to make sure that it is symmetrical and lining up, as well as looking at his back. His chest and back should be in a cone shape, such as going in that order, so kind of like that, or like that. Next thing we'll do is, as we look at his chest, we'll palpate it, and as well as I'm palpating, I'll be looking for any indentations or bumps, and I'm not feeling anything so far. I do notice he has a small macule, but it doesn't raise any question. It's similar to the other ones in less than 6 millimeters. We also can see that he's ticklish. And I'm also looking for any discoloration in skin, more specifically discoloration such as pallor, which is paleness, or cyanosis, which is blue. Since he is his skin tone is pigmented, you also can look at his sclera in his eyes for signs of cyanosis or anything like that. So I do not see any signs or indentations or bumps or lesions that raise any concern. Everything's symmetrical and smooth, so there's nothing there. So also we'll pay attention to his anterior and posterior to transverse ratio, which seems to be okay. So that's good. And another thing we'll do is check out his expansion of his chest. So I have you stand up, turn to the back. And so what I do is put my hands here, my thumbs here, and I have you take a deep breath. And as he takes deep breaths, my hand should expand with him. So another one. All right, good. Okay, you're going to take a seat. Okay, so that was good. And you notice that my hands expand with his chest. So next we'll do is we'll auscultate and do the lung sounds, and then we'll get you out of here. Alright, so the first thing we'll do is listen to his trachea. So don't take like super deep breaths, just deeper than normal, okay? Good. Okay. And the next thing I'll do is listen to his chest. When you go down the chest, you also compare and listen back and forth, okay? Okay, and the next thing I'll do is listen to his left lateral. So what I'll have you do is stand up and turn this way and lift your arm up. And you listen in 2 positions or 2 spots. Okay, and then I have you turn and we'll listen to his right lateral. So with the right lateral, you listen in 3 spots because you're on the right side of the lungs, and the right side of the lungs has 3 lobes. So you listen kind of like a triangle shape. Next, we'll auscultate his back, and the same with the chest. You just go down the back and also compare side to side. So we'll start up here. Deep breath. Also, when you're auscultating the back, make sure that you go around the scapula, because it'll block out the sound. Okay. Deep breath. Deep breath. Again. And one more time. Okay. All right, you can go ahead and take a seat. Okay, so in the tracheal region, in here, I heard bronchial breath sounds, and then in the center of his chest, and as well as posterior, or his back in the center, I heard broncho-vesicular sounds, and then all throughout the periphery here, and in the periphery of his back, I heard only vesicular sound. So that's what we plan to look for. So, Mr. Banks, the assessment went well for you. I thank you for coming. Thank you, and I thank you guys for listening.
Bye.